on today's webinar, but today we're going to talk about some evaluation, and we have two great experts with us today that I will introduce here shortly. But my name is Crystal Dalmasso, and I am with DECA. I'm with Prevention Services. I'm a community support specialist of the South Central area with DECA. And we are going to talk about evaluation. Evaluation is part of the Strategic Prevention Framework, the SPIF, as you'll hear us probably say a couple of times today. SAMHSA developed the Strategic Prevention Framework, the SPIF. This process really uses 5 steps and 2 guiding principles to offer prevention planners such as yourselves a comprehensive approach to understanding and addressing the problems of substance misuse and related behaviors and health problems facing your communities. So before we really dive into evaluation, which doesn't give me anxiety anymore, but thank you for being transparent. And for those of you that kind of felt that anxiety when we say evaluation, Mike, can you put up that poll, that #1 poll? Tell me what you think. Evaluation begins either before implementation begins or once the strategy is complete. What do you think? And I'll give you about 10 seconds because you only have 2 choices. When do you think evaluation begins? Before implementation or once the strategy is complete? You can vote or you can put it in the chat if you can't vote. I know sometimes Zoom can be a little wonky, so click your voting. Mike, can you go ahead and complete the poll there?
We're at 75% voted, and we've got, here we go. And we have 1 response in the chat box that says before.
Yeah, awesome. So for those of you that said before, evaluation really is at the heart of every step that your coalition is taking throughout the Strategic Prevention Framework, throughout this SPIF. So planning, action, and then celebrating. So evaluation begins before implementation. So good job. It's important for future decisions about sustaining strategies. It's all about making sure that the right information is gathered in the right way and is provided to the right people. It really tells us how things are working. So I have this short little video, and it's not trying to persuade you to get data from a certain place, but I thought it kind of sets up a good picture for where we're going.
As parents, educators, policymakers, society, we all want our children to be prepared for the future. But when faced with overwhelming statistics, we wonder how it is possible. If we break that overwhelming statistic down into manageable pieces of information and data points, we can understand how to tackle the problem. Only with data can our students navigate the increasingly global and complex maze of decisions ahead and avoid becoming part of the overwhelming statistic. We all want to answer the question, how are my kids doing? What has proven to work to get my child on track for future success? Are my students learning enough in 1 year? How much does it cost to make students college and career ready? The problem is we're using an outdated paradigm where data is inaccurate, expensive to obtain, difficult to transport, and flows in only one direction, up. In nearly every other field, they use data differently. We can visit multiple doctors in multiple places and take our data with us. Businesses strategically gather data and tailor it to their specific needs to make the best use of resources and provide the best return on their investment. We rely upon law enforcement to use data to identify issues before they become serious problems, because the stakes are high and the risks are real. To answer our questions, we need a new paradigm in education, where data is in context, reliable, timely, portable, and flows in all directions. So we can tailor data to find out exactly where we are and where to go at each turn. And we can be notified instantly if we take a wrong turn. so we can all know where we stand and that our children are on the right path. Most states now have data to answer our questions and accomplish our goal. Let's use it. Because if we're not using data to determine where our children are going, what are we using?
So,
Data is...
sorry about that. So I chose that because I was looking at the way that they lined out the data points and the way that they use the numbers on there and connecting the dots basically. And you need different data points. Okay, I'm going to get ahead of myself. So I get excited sometimes. But I liked, especially when they had what they said in there about you use that data to make real-time decisions. And so evaluating, thinking about the SPIF and thinking about evaluation all through the different steps of the SPIF is important. So evaluation really does then help you understand what strategies are working and what are not working in that planned and organized way, kind of like the video was just showing us. The results of your evaluation may be used to refine your program implementation, then concretely illustrate progress towards program goals, and then ultimately recruit funding for evidence-based programs. The goal of the strategic prevention framework is to implement those evidence-based strategies and programs that fit within your community's population needs. So we're not trying to implement strategies that fit other population needs. We want to fit what's in your community's population needs. So evaluating the strategies that you've chosen can help you then determine whether the strategies do in fact fit your community. And then the evaluation process is measuring if what you've chosen is then effective. So two types of evaluation are process evaluation and then outcome evaluation. Each type of evaluation answers then two questions and therefore has different intentions, measures, different data sources. And using these types of data will help you and your community members monitor the implementation and then improve your implementation strategies and performance. So process evaluation documents all aspects of your implementation strategy. It really describes how the intervention was implemented. For example, what materials you used, what methods were used, was the strategy implemented with fidelity? We say that a lot. Or were there modifications made? And then outcome evaluation documents whether the strategy made that difference and then what changed. It documents the effects achieved after the intervention is implemented. So it tells whether your activities have made a difference in your behaviors or your consequences. It really can help you decide whether to expand what you're doing or terminate what you're doing and then shift your resources elsewhere. So I'm curious if you guys will respond in the chat. We're going to bypass the second poll mic. I'm just curious if any of you have actually decided, if your coalition has decided to discontinue a strategy based on evaluation results. And if you feel comfortable sharing, yeah, we decided to discontinue or we chose to go a different route. Oh, yeah. If you're new, you might not know maybe from past. But evaluation data can really then help you decide if what we have implemented then, although we like what we're doing, may not be effective. And so we might need to decide to discontinue that strategy and actually take our resources and put it towards a new strategy. So really there's 5 basic functions of a coalition's evaluation process. So improvement helps the community to build skills and improve its health. Coordination involves communication between diverse partners knowing that everyone is doing and keeping them engaged over really long periods of time. Accountability involves tracking the value that's added. And really this function is about tracking the specific things that everyone does. The question that you want to ask here is, does the evaluation hold your coalition accountable for the community level desired outcomes? So everyone involved should know what their role is and what the role of the coalition plays in the community. Sustainability is that long-term goal, and you should be asking the question, does the evaluation help the coalition sustain itself for long-term goal achievement? And then, of course, celebration, which is extremely important. Does the evaluation help the coalition celebrate its success along the way? And it really is important to take time to celebrate, because it reminds the coalition members what making an impact is doing, and it reminds the community that the coalition is playing an important role within the community. So evaluation can seem daunting. I told you my anxiety at the very beginning about about evaluation. Some of you shared the same thing. So to help, the first step could be designing an evaluation team, putting together a team. I know some of you on here are from coalitions that have an evaluation team, which is really great, because then that team can kind of walk through the process. So evaluation, remember, it begins before implementing strategies. So you really do want to create your team early. This team may or may not be the same people who are involved in your needs assessment and strategic planning process, but these individuals really do, they should be willing and able and be responsible for implementing the evaluation activities. So it's also helpful to have people on the team who are knowledgeable about research practices. So not just excited to be on a team and be part of the coalition, but have some knowledge about research practices. And I know that some of you on here are on research teams. One way to utilize an evaluation team could be to create evaluation action plans, which would include evaluation questions. Evaluation measures are simply the information you're going to use to answer your evaluation questions. So when developing evaluation measures, your evaluation team will want to make sure that they're good ones, that they're a good fit, and that they're good evaluation questions. So a good fit considers both what you can measure and what you can derive from it. So you really want to make sure evaluation measures should follow that SMART principle. So they're specific, they're measurable, a system, a method, or procedure exists which allows the tracking and recording of the behavior. They're achievable, and they're relevant. And make sure that they have realistic and they're timely. You don't want to put in questions that need to be answered over a period of time that are not achievable. So there are two types of data collection methods, your qualitative and your quantitative methods. Your qualitative methods really do answer the why and the how, and really involve talking and observing people. So you emphasize words, and you do your interviews, you do your focus groups, you participate with people. And according to SAMHSA, qualitative methods can be useful for describing a situation. You can provide insight for your intervention approach. So it tells part of the story, where your quantitative methods answers the who, the what, the where, the how. It really does emphasize the numbers. But when you put these two together, it tells a more complete story. So when you are doing your research, when you're collecting your evaluation and you're collecting your data, using both methods then, rather than just picking one over the other, really does tell a more complete story of what's happening within your community. So there are many ways you can put your evaluation results to good use. They can be used internally to help make decisions regarding your programs. Like we said, sometimes you have to decide whether resources need to be switched and strategies need to be changed. Or They can be used externally to inform the public about your organization, the work you do, as well as prevention needs and goals. It's really important that the coalition and the community know what the purpose of the work that you're doing. So understanding what the intended outcome goal is targeted will make it easier for the coalition and the community to celebrate success. So reporting evaluation results is key to celebrate those outcome successes, and making sure the community knows what that outcome goal is within the community is important. So when providing these reports or presentations, there are really several tips that will help you communicate your message. You've got all of your data. Sometimes when reporting this data, especially when you're a data person, you want to get all of the data to your coalition or to your community, but you need to remember to keep tables simple. Too much data can be confusing. You want to make it copy friendly. So if copies are made over and over, sometimes color can be lost. Really give it that glance test so that the casual reader can understand it. Presenting data in more than one way to think about parents. So if you say 2 in 5 high school students, it might be more impactful to say things like 40%. So thinking about how people interpret data. So all of these tips would be important for really then presenting that data. One thing that on here though that I want to make note of, it seems really simple, but using grammar and spell check, when you're presenting your data, you lose credibility if things are misspelled or the grammar is not correct on here. So just make sure you give it another set of eyes. Couple more tips on here, using quotes pulled directly from data, giving it that 6 rule. A lot of people like to cram a lot of words on a visual aid, and so your audience can't see everything or read through everything that you're doing. So just highlight your data. And then of course, avoid fancy language. We like to use jargon. I explained what the SPIF was when we first got started, the Strategic Prevention Framework, but our jargon, our acronyms might not mean the same thing to other people outside of our organization, so keep that in mind. So working towards sustainability as you progress through each phase of the SPIF, that Strategic Prevention Framework, takes a lot of intentional effort, but it's really well worth it and can make all the difference. I know our 2 experts are going to talk about it here in just a second. One thing that I don't want to walk away from here without talking about though is applying that cultural competence to each step is also equally important. So your relationship with members of your community really does improve and affirm cultural aspects. So making sure that you're working towards including cultural competence in each phase of that SPIF. Mutual respect, understanding, and acceptance of how others see the world are critical to your success, just like evaluation is critical to the success of your coalition as well. So you've heard a lot from me in the last 20 minutes, and I tried to go really, really fast just to kind of set up evaluation. But we have 2 awesome experts on the call with us that I want to give plenty of time to share their stories and then open up the chat. We have Dr. Bay and Dr. Mayes with us, and I'll introduce the both of them, and then I'll let them share their stories, and then you guys can ask questions of them. So, sorry. Dr. Bay is with us, and Dr. Mayes is with us. Both. Dr. Bay is a Wichita State alum with an interest in mental health and minority groups and policy research. She has served the Wichita community as a staff with Safe Street Substance Use Prevention Coalition, serving on Youth Advocacy Coalition Steering Committee, and volunteering with Lesson, Kansas. Alyssa has served over 6 years of academic research experience and 4 years of evaluation experience, including working with the community evaluation projects. She really does love dogs. I can attest to that. Being outdoors and binging Game of Thrones during this pandemic quarantine time. Dr. Mayes is a recent first-generation graduate from Wichita State University with a doctoral degree in community psychology. She is also a current master's in public health student at KU School of Medicine, Wichita. She is passionate about helping underserved minority populations, specifically in regards to health equity and access, as well as health literacy and general education. She has years of experience with research, evaluation, program development, grant writing, and public health evaluation techniques. Most of her experience stems from her academic background, as well as her work experience at Safe Streets Wichita and Community Engagement Institute Center for Applied Research and Evaluation, which she is still, I believe, at CEI, correct? Awesome. So I'd like to open it up to Dr. Bay and Dr. Mayes, and I can stop sharing my screen and let both of you tell your stories and about your research, and then we can open it up for questions.
Hello, can you all hear me? Can you hear me, Crystal? Okay.
Yes, yeah, you're good.
Hi, I'm Alyssa. So I'll talk about a few things. First of all, thank you, Crystal. You did a really good job of highlighting a lot of important things in evaluation. So I'll re-emphasize some of those things, but also just add some kind of examples from my own work with evaluation. So I just completed a really big project that it actually wasn't evaluation based, but I think some of the examples I'll give and some of the things I'll talk about are really good to know and apply in evaluation situations. So I was looking at within the Wichita area assessing depression in the immigrant community. So I am not an immigrant. My parents are. I don't have a lot of friends who are. So I was very much outside of any group that I really kind of had access to. I think a really important point that I learned with that was to find so-called gatekeepers or people who are going to kind of help give you access to that group. So if you want to do an evaluation on something related to schools, so maybe you want to see what substance use prevention or what tobacco prevention programs schools already have and are they working? Thinking about maybe finding a gatekeeper so to help give you access to that and help you evaluate that program so that you can know kind of what are the needs and where are the gaps and what needs to be filled kind of with that. So I think that's a really important point to think of. And I know in coalitions we think of like building relationships and things like that, but really just emphasizing that when we're going into evaluation, because not only did it kind of allow me to have access to that community, finding a gatekeeper in the immigrant community, but it also built trust as well. So the people who were the gatekeepers ended up, they were like, oh yeah, I'll go in and like pass out your surveys, you know, and really talk to the community. And a lot of it was not in English. And so they were like, oh yeah, like I got you, like I speak Vietnamese or Spanish or whatever it was. So just kind of thinking about that and like building those relationships when you are doing your evaluation work to really kind of build that trust in the community, because that allows for a lot. So I've also done, it was more of a needs assessment, but at I used to do some work at a child care center. And we wanted to see from a parent perspective, evaluate what were the thoughts that the parents had about the program. Is there anything that they were missing? Is there anything that they were needing or liked or didn't like? And so that was an example of when I kind of took this project on and was really excited about it, but the parents didn't know me, they didn't trust me, and you could kind of see it in their responses. They're like, everything's great, we love it, it's wonderful, nothing is wrong. And I think that was kind of a moment for me where I had to kind of think about my position of power too. So if I'm coming from the central office and I'm saying, oh, I want to do focus groups with parents, they're like, oh, this lady's coming from the central office, like she's going to take our services away if we don't say that everything is perfect and wonderful. So even though a lot of you all are coalitions and community organizations and things like that, it's still really good to think about your position of power. And like, are you someone that do they know and trust you, or are you someone that they could potentially think that if they don't answer this evaluation survey correctly, or if they don't answer it in this focus group correctly, someone's going to take my services away, and, you know, things like that. So in that case, it probably would have been better to, you know, partner with one of the teachers at the center, or, you know, do something like that to establish a little bit more trust as well. I have a few things written down. Oh, someone in the chat asked about infographics or tables. I love that question. Oh my gosh. I really think it depends on your audience. So whenever I present to more like academic audiences, I tend to use more like tables and really formal things. But for that project that I'm working on with immigrant depression in Wichita, I'm definitely creating an infographic, because a lot of the immigrant serving community organizations that I worked with for that project asked if they could have that data and know what that data was, so that they could serve their clients better. So that's a very non-academic audience. And so I am definitely going to use, you know, the pretty pictures and the colors and things that kind of grab your attention, and maybe even just specify more so to, like there were a few specific like cultural churches or things like that, or maybe like cultural Hispanic like organizations. So maybe even tailoring what data I put in there for that specific audience. But I love that question. Yeah, I've used a lot of different things to kind of convey the results of data. It really depends on your audience. I've used anything from like memes to like very technical reports. So yes, that's great. And then I kind of want to reemphasize something that Crystal said, is making sure that the data that you're getting is kind of what you need. You said something along those lines. So if you are, there's a lot of evaluation tools out there that already exist. So sometimes you won't have to find your own evaluation tools, like the tri-ethnic community readiness for change assessment tool. That's already out there, so you don't necessarily have to create your own evaluation questions. But if you do, making sure that you are measuring what you have to report on, or the specific thing that you want to see. So if you're looking at tobacco use and you're wanting to see, did my program decrease tobacco use? So there's a lot of ways that you could do that. So you could ask the question, how many cigarettes are people smoking per day? How many packs of cigarettes? There's have you smoked at all in 30 days? But if you don't want to ask the question about like how many cigarettes are you smoking, if you're really wanting to look at 30-day use. So just making sure that language lines up specifically, so that you're reporting on what you actually want to see. I think that was a really good point that Crystal had. In the project that I worked on with the immigrant population, I did qualitative and quantitative work, like Crystal emphasized. So my quantitative piece was really looking at the relationships between demographic factors and depression. So it was looking at, you know, and then the just prevalence of depression in general. So it was a lot of like, how much, like Crystal was saying, like, is there a relationship? Or, you know, for a lot of things and some of the work that you all might do in your community, it might be like, what's the percentage of people who blah, 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 is a lot of the quantitative. And then I used the qualitative piece. So I held focus groups and things like that to determine kind of what is kind of contributing to that depression. So asking them, what do they feel like people in the immigrant community are impacted by as far as their mental health? Are there services that are in different languages and things like that? So that would be just harder in general to have a quantitative piece on, so to have a survey on that, because there was just a lot of really rich data that came out of allowing them to talk about that and allowing them to kind of and especially talk with others about that. That's the cool thing about focus groups, is sometimes people will like bounce ideas off of each other. So they'll say, oh, I had this experience, and then another person will be like, oh my gosh, that was my experience too. And qualitative data is kind of, it's harder to understand because it's not numbers, it's not things like that. But generally what you want to get out of qualitative data is some kind of themes. So if things are mentioned multiple times and come up as a theme, that is a really great thing to kind of get out of that qualitative piece. And then, I wanted to talk about transcribing too. So transcribing is just pretty much if you have a focus group and you record that focus group, getting permission, of course, to record, especially if you work with a sensitive population or vulnerable population. Like, I think a lot of the work that you all do is probably with vulnerable populations. So I was working with immigrants, so I wanted to make sure to ask permission to record, because, they could be like, who are you sending that to? Or, what's happening? So that's an important piece in building trust as well. But so having the focus groups, recording the focus groups, and then transcribing is just writing out or typing out everything that was said in the focus group. And it is very long and boring and tedious, but it is actually an important piece. I know it's easy to just, sit there and take notes when you are doing an interview or a focus group for evaluation, but if you transcribe what the conversation that took place in the focus group, then you can pull out direct quotes instead of just having something to go off of in your memory. And that can be really important if you, evaluate a program and it works really great, and maybe the people that you're serving really loved it, and someone expressed that really well in a quote, and you want to take this to the school board or the city council or something like that to maybe implement this program in a larger capacity. They talk about policymakers wanting numbers and then stories. So that is really important when you can bring a direct quote that someone said to have a great piece of their story, and it kind of touches their heart. So I think that's all on my list for now. So I will let Peyton talk, and then if y'all have any questions, I'll answer those.
Awesome, thanks. Yeah, Peyton, go ahead.
Hi, everyone. I just want to start off by saying my nieces and nephews are here, so you might hear some banging around in my living room. Sorry. So I am really just going to reemphasize a lot and provide some examples of what has already been said. I think Crystal and Alyssa did a wonderful job of already explaining a lot of things. So I also just got through doing a big project, my dissertation, and it was basically around sickle cell disease and knowledge and perceptions about that. So very public health focused. And I'm mostly going to highlight the methods in recruitment. I'm not going to bore you with the background and all that stuff. But for the methods, so I had 4 different populations that I was looking at. And one of them was Black people, Latinx people, healthcare providers, and then kind of everyone else that didn't fall into one of those categories. And so when recruiting, you have to really tailor your recruitment to the population that you're trying to reach. And there were communities that I am not a part of whatsoever. Even the community that I am a part of as a Black woman, it's still hard to engage with other people who are Black that might, because there's just a difference in them seeing me as a professional or something like that, and then trying to go into their communities and do work. That's even still hard. So even going to a place that you're not a member of, that's more difficult. So it's kind of just difficult across, but it can easily be remedied with, like Alyssa said, reaching out to gatekeepers, finding champions within the community to really advocate for your project or your work. And let's see, Alyssa already mentioned building trust and building relationships as a key to really, getting at what you want or getting at the population that you want to. So for me, I had to reach out to medical organizations in order to find medical students or doctors. I had to kind of utilize a lot of different resources, and it took a lot of time. And I think that's one thing that's essential in understanding anything related to evaluation, anything related to research, is that it takes time. And it also takes person power. And so I think one of the things that I wanted to emphasize is that evaluation isn't a one-person job. Like, it's not just something that you can just assign to one person and be like, hey, evaluate this. It really takes a team, and it takes cross-collaboration. And what I mean by cross-collaboration is making sure that the community that you're trying to serve is at the table at all times throughout the evaluation process. That is very key for not only establishing relationships, building trust, but also, being able to integrate a vulnerable population that you're not a part of. And it's also key to making sure that whatever it is that you're attempting to evaluate is going to be culturally tailored, especially if it's like a program. So I'm going to use my experience at Safe Streets, Botmans. So if you were going to create an evaluation for Botmans, if there's evaluations that already exist, so this is just purely hypothetical, but if you were to create an evaluation because one didn't exist, you would want to make sure you ask questions related to the cultures of those that you are trying to include, those that you are targeting, to make sure that it's culturally relevant, especially, again, if you're outside of that community. That's essential. What else did I want to talk about? Evaluation can occur at a bunch of different levels. And when I'm saying levels, I'm meaning socio-ecological levels. So that's meaning at the program level, at the organization level, community level, and then local, state, or national levels. So it's really key to understand what level are you trying to assess with whatever you are evaluating. So going back to the Botmans example, that would be you're evaluating the project program. So that's at the very bottom level. But maybe you want to take Botmans and, really use the knowledge gained from participants of Botmans and maybe change a policy, that could then be either community level, because you could be changing a policy at schools related to what you learned from your students in Botmans, or that can be at the local, state, and national level. Something needs to change there. What else did I want to speak about? Oh, I wanted to emphasize also, so me and Alyssa both had to try and recruit people from the Latinx or Hispanic community.
Can I play with toys?
And yes, you can go play with toys. So we both had to do that, but Alyssa had a better experience than I did because she had that champion in place. I did not have a champion in place. I tried to get champions in place, but it's hard if you're trying to start a new relationship with a champion and also trying to access a population that they're able to access. That was more difficult for me to do. Let's see what else. Also, I wanted to emphasize kind of some differences in our methods approaches too. So I did focus groups and I did a quantitative survey as well. But a lot of my interactions with people took place via electronic methods. So emails, I don't think phone calls will be considered electronic, but maybe. But a lot of it was electronically based. So the survey went out online. The people that I had to contact in order to get access to medical providers, that was all electronic as well. Whereas Alyssa's was more grassroots. And I think that is probably the experience that a lot of you who are working in coalitions will have. It will be grassroots efforts. And so that's another thing to consider when thinking about, methods and stuff like that. I am going to actually stop talking now so we can move on to the questions and answers, and I can go and check on my niece. Sorry.
Oh, you're okay. I think we've all been in this position. I'm going to pose a question real quick, and then if others have questions, please feel free to put them in the chat, and then we can get to them as well. But I know that neither of you are from Wichita, and then you were accessing populations within Wichita. And so, and you mentioned finding a champion, but can you also kind of address not being from this area, some challenges or barriers that you might have hit not being from the area and then having to come in and collect data?
Mm-hmm. So that is still true. So I've been in Wichita for about 8 years, but I've been very, very much in Wichita State, and like, that's it. So I still really, at the beginning of this, wasn't super connected with the community. So like, people will still to this day mention a school in Wichita. I'm like, I have no idea what that is. But I think it was really helpful to, I kind of had to search. So I had to search like language classes and things like that. Just do an online Google search and kind of go to wherever the population was. So within this, I like attended a lot of church services, attended like different cultural groups, went to different language classes and things like that, to really in places that I had never been before. So really just kind of discovered not only Wichita, but more specifically like within the immigrant community, like where kind of those spots and things like that. So, and again, I think that also helps build trust, but also I think this is really important. So if you all have a group that you're evaluating, or if someone does help you with evaluation and you do find a champion, to follow up with like a thank you. So I can't even tell you how many like bags of cookies I baked because it was just seriously, without those champions, my project would have never happened. So so as you're evaluating programs and things like that, if say you're thinking about implementing a program or taking on a program, and you want to evaluate it or whatever, if someone helps make that connection, then really just kind of writing a thank you, or baking cookies or whatever you want to do, a thank you from your coalition in some way is really important. But yes, it really took, like Peyton was saying, that boots on the ground, like going and, spending Sunday mornings or spending, Saturday evenings to build those relationships. Because even though I've been in Wichita for a while now, I really have been connected with WSU, not with the whole community. So those are some of the ways that I kind of helped get that knowledge or get more knowledgeable about the Wichita community.
Would you say, one of the questions that I get asked is, why is a pre and a post survey important? Can't we just do a post survey afterwards and collect the data that we need on a strategy? So what would your experience say to pre-post surveys?
Mm-hmm. Peyton, do you want to talk about that?
Yeah. So pre and post surveys are very needed. I'm trying to think of a good example that's not Botvins, because that's all that's in my head right now. I'll just make a hypothetical example. So if you're wanting to go in and figure out, how many students are vaping at school, and you want to implement some program to target vaping in schools, thank you. The first thing
On that
the
side?
first thing that you would want to do is to get a baseline. And that's what the survey is really for, is to understand where are people at right now in this moment before anything has been done. And then you would implement your program. You would then evaluate your program. And I think the evaluation in that sense, even though you would be working on, evaluation methods, the entire process would be the post-survey to evaluate, is this program working how it should, but also what has that number gone down, has it increased? And that's really the importance of pre and post, is to understand things before something is implemented and after something is implemented.
And
So
that's another important.
sorry. I'd say it's worth taking the time to do the pre and the post.
Definitely.
Yes. And that's another thing that Crystal talked about, making sure evaluation starts at the beginning. So if only at the end you think about evaluation after you've already done your program, then you're not going to be able to get that pre-survey. If you do a post-survey, I mean, you know where your students or your community is at right now, but you don't actually know if your program made a difference. You're really just assessing where they're at in that moment. So I think that really speaks to what Crystal said about making sure you kind of, whenever you're creating your program, or if you decide to take on a new program, making sure that evaluation is thought about from beginning to end, so you can be figuring out what questions you need and if you need to do a pre-survey. And really, another thing I wanted to emphasize was evaluation being really a resource, so that like your organization isn't wasting money, isn't wasting time. Like it's I know Dylan put something in the chat about what did you say, Dylan? That it was judging or something like that. Somebody said judging or something like that.
Judging. Yeah.
Yeah, and it really does feel like that, right? It really does feel like that. Like, oh, we've been doing this program for 10 years, and you want to evaluate it and take it away, or say it's terrible. But it really is a great resource to just see if if is this something that maybe it needs to be enhanced. Maybe it's not working in the way that we thought it was, even though we might be really, really attached to this program and it's something that we've done for 10 years and we built it from the ground up ourselves. But the most important thing is the outcomes of the people that we're serving. We want to make sure that it's actually something that is working and benefiting them. I really think that evaluation is like a tool for health equity. So how is this program serving some of the more vulnerable populations? My interest is minority mental health, so I'm always asking the question, how is this program serving some of the minority groups? So it may be working in your general population, but is it working for everyone? Is it working for those kids who come from low income backgrounds? It may or may not be. So it really is a tool for health equity. It really is a tool to see if you're using your resources in a way that is helpful, or if you need to reallocate some of those. It very much can feel like a judgment tool and things like that, but it should be more helpful than anything, hopefully.
Well, and if our goal is to be effective,
right,
we really want to make sure that we're using our resources the best way we possibly can to reach all of our kiddos in our community. So
even if we're really attached to a program.
Even if we're really attached to a program.
I'd like to comment on that a little bit. Sorry, I keep getting distracted and then I'll lose my train of thought.
You're good. A lot of us have been working from home, so we totally get it.
But I wanted to talk about, Alyssa just said something about, oh my gosh, I had it. It was like perfect too.
We're talking about health equity. and reaching the minority populations so that we're being, strategies that we put in place are reaching everybody within our community.
Yeah, I lost it.
It'll come back to you.
Come back.
It'll come back to you. You think about it, and then you just
okay. I just remembered. Sorry, everyone. She was talking about, like, to me, that, you know, you might experience some pushback from people because they're like thinking, you know, well, we've done this program for years, nothing is wrong with it. And I think one of the important things in that case is to not only educate whoever it might be, stakeholders, about why evaluation is important or why your program, like improving your program, is important, would be key. And that also brings along, you know, presentations and making sure that you're presenting information in a good and clear way to not only stakeholders, but people in the community. Talk to them about why this change or why this program is important. That's a really big key to evaluation as well, is making sure people understand and presenting information to people. So that's all I want to emphasize on that.
Cool. Well, if there are no other questions in the chat, I think you guys have covered all the questions that that have come in, and that I had to ask of you guys, of you ladies today. So I want to say thank you for coming on and sharing your experience with your data, your evaluation experience with Safe Streets, and your research, because I know you guys are doing very important research. So from the bottom of my heart, thank you for coming on and sharing. So hit these ladies up if you have more questions, for sure, because they do have valuable experience and can share with you as well. I know Dina has put some resources in the chat. So the Community Engagement Institute has resources that can help you out. Greenbush is fantastic resource for evaluation. They help out communities every day with evaluation tools. DECA has e-learning modules and toolkits on evaluation. We just showed a portion of the e-learning module today, and the evaluation link is in the chat. We ask that you take that survey so that we can get information, so that we can bring training to you and bring you what you need as well. So please, 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 we just did a training today on evaluation. Please take that survey so that we can get our data collected as well. So thank you for your time. Thank you, Peyton and Alyssa, and congratulations on completing your doctoral degrees. And I hope everybody has a fantastic day. If you know of some youth, we have a youth webinar this afternoon on opioid prevention. Make sure you get them registered. There's still time, and get them on that webinar this afternoon. Have a fantastic 4th of July.
Thank you. Bye.